We're the Hydradenitis Super Divas. If you've got HS, you'll want to meet us. It's not your fault, put the shame to a halt. HS divas know how to have a ball. The Hydradenitis Super Divas. Put the shame to a halt, cause it's not your fault.
Hey guys, it's Brinley with the Hydradenitis Super Divas. Thank you for joining us for this episode of Season 2. Just a heads up, if you are watching on YouTube, you will not see any video of the hosts. Unfortunately, the recording was stuck on time-lapse, which is not super helpful. So we do have all of the video of the guest who was on Zoom. That's perfect. If you're not watching on YouTube, this has zero bearing on you at all. Everything will still run just as it should. So just a heads up that, again, we won't have any video of the host, but we hope you enjoy the episode. Thanks.
Hi guys, welcome to another episode of Hydradenitis Super Divas. It's your girl Hala. I am here with Brinley and Sid. Today we will be talking about wound care. So let's get into it. I definitely feel like this is y'all's specialty, so I would love to hear. You guys will be educating me today.
Okay, I heard you say Band-Aid, and sometimes it makes me
I know, y'all cry.
I know. She has like Brinley's name.
No. Okay, but hear me out. When I did say Band-Aid, it was more like just covering it up. That's truthfully what I meant. And I was
and
the Band-Aid speech just came.
Band-Aids can be used in HS, but they're really not a preferred method of covering wounds. And the reason is, especially if you have a wound that is draining, they are not meant for that much drainage that comes out of our wounds. So what happens is it sits on your skin and it's not wicking away that moisture, and that is what creates like yeast from having that drainage sitting on your skin all day, because it's really not enough.
So the gauze is absorbing more, so that's better for you? Because in my mind it's the same concept though. Something's covering up and essentially
covering. Yes. So, and gauze is more breathable.
Okay.
Band-Aids hold more moisture in, and they also can harbor more bacteria.
Okay.
So it's definitely recommended to use gauze. And if you think about like a Band-Aid and you only have this like little 1-inch section of coverage, and think about how thin that is versus if you took like a 4x4. So when we say 4x4, we're meaning like a 4x4 piece of gauze. So if you took a 4x4 and like, folded it up and taped it on, you would have much more absorbency through all of those layers of gauze.
Yeah. Unfortunately, I guess too with my career, I don't always have the option to literally have thicker things.
Yes.
So Band-Aids have worked for smaller things.
Yep.
And I don't really use them when I'm leaking, I guess, but just to like cover something that may be there, But okay, good to know. I shouldn't be doing that.
Yeah. So it's
also might be out of some work, but
it's
I think for you especially, Hala, it's just like doing the best you can with what you got.
Yeah.
Like, I totally understand. I'm like, she can't be on set of Nike, and it's like, lonely.
Yeah, it's not an option.
Let me wrap my
whole shit up, It's like, okay, we're ready for the photo shoot. It's kind of just like,
and
what you have to
sometimes
do.
it's not even with the clients. Like, they try to accommodate the best they can. Like, I tell a lot of my clients I have HS, but like literally they have to sell the product, So it's like, I get it.
No, and we totally,
I get it,
And I should specify, like, so this is the most preferred, but it doesn't mean that you can't use something else like in a pinch.
Yeah.
But we're just saying like on the regular, it's better to use a gauze product or something like this is called I don't know how to even say it, Vitale, Vitale, silicone super absorbent dressing. So this is something I was just introduced to by Wound Care, and it's basically an absorbent gauze. And the inside piece of the gauze
like a Band-Aid.
is sticky too, so it actually helps debride a little bit while you're going through it, but it does not hurt to pull off.
Okay.
It's very flexible. I've actually been using this. I brought this for you. So now you're going to have my fingers on it. But
I'm going to get infected.
I've been using this for my pilonidal cyst after surgery, and so I've been putting it in my crack this way. On an angle, and so I just tuck this in between my little butt cheek action there, and then it stays all day, and it is very, very absorbative, so it has layers of stuff in there. So yes, while it does look thin and like a Band-Aid, it's more wicking to pull it away.
I'm like, I need it to look like a Band-Aid, guys.
Yeah.
Okay, for my mental health. No, I'm kidding. No.
And so these kinds of dressings, they're silicone bordered dressings is what they're usually called. This one even says it's super absorbent. So these are actually really good for pilonidal cysts, and they come in different sizes too, which is really nice because sometimes, you know, abscesses are larger, sometimes they're smaller, and you may just need a smaller one. So.
Or the area, you know, like trying to get certain stuff to stick on like your booty cheeks.
Yes.
To feel like it's a hit or a miss.
Yeah.
And Brinley, I remember once I asked you about using like triple antibiotic ointment, and you told me something about it.
So the problem with using something like Neosporin or triple antibiotic ointment is that a lot of people are actually allergic to it.
Okay.
So typically they say use either Aquaphor or Vaseline instead.
Okay.
Because we don't really need the antibiotic piece of that.
Okay.
And between Neosporin, between Vaseline and Aquaphor, Aquaphor is pretty much along the same lines, but it has vitamins and nutrients in it.
Okay.
And Vaseline is just straight Vaseline. So you're not really getting anything else. So we typically go with Aquaphor. Okay. And it is okay to put Aquaphor in an open wound. Mm-hmm. So if you need, you know, let's say you were going to use this bandage, but you wanted to put some Aquaphor down below it, you know, between, so that you could have this not necessarily be like so directly on a wound. You can absolutely put a layer of Aquaphor on an open wound, so there's no issues with that.
Okay, perfect. That's so cool.
Yeah. For me, with my wound care, I think I mean, of course, I use my Magic Healer, but you just have to make sure that you are putting it on, like, if your flare's actively, like, in that draining stage, you do want to make sure, like, you're kind of just cleaning up as much as you can before you're going in to change your dressing. And then also, like, it's okay to change your dressing. I used to, like, just do whatever I did in the morning time, and I'm like, okay, like, see you for bed, you know? But sometimes, like, the draining could be so much that, like, go in halfway through the day, I know you use the bathroom, and swap it out. You know, like, it's okay, throw it in the trash, even though some of these are so great at holding a lot of that gunk. Like, if you have time to change it and it's halfway through the day, like, baby girl, just change it. Yeah. So make sure that, and I think that was a critical thing for me, giving myself permission to carry around the things that I would possibly need to change my dressing in the middle of the day. Like, even yesterday, I was like, the fact that I forgot my flicker kit, like, girl, you get around other people with HS, and I mean, I think it's just a comfortability thing with us at this point, because I'm like, look, Brinley brought a bandage for me today, so I'm good. But I'm like, just bring your stuff and set yourself up to where that way it's better to have it and not need it than need it and not have it. So I just make sure that I'm cleaning my site, and then going in, you could use the purple My Magic Healer on open flares. And so that's why people are like, well, which one should I start with? You use the green and the purple. I'm like, start with the purple, because the green has added essential oils in there, and some people are just essential oils just kind of like irritate their skin, or a lot of people don't like the smell, and that's okay. So start with the purple one. It could go on open wounds, open flares. It's super multi-purpose. And then make sure that, like, if you do have a flare that is like big, the inflammation's pretty, like, it's angry is what I call them, the angry ones. Make sure you're using that breathable gauze and putting something to keep it in place. I know when I have some on my inner thighs, because I couldn't use, or I was afraid to use, like, adhesive, I would use Coband, and I just ordered it in bulk off of Amazon. They sent me like 15 different colors. It was like $12. And it's just, like, super cool. Sometimes I match it to my underwear and make me feel good, you know, I'm like saucing up my HS. And it's like little things like that. I've literally turned my wound care and my flare care into a form of, like, self-care. Because I'm taking care of this, because for so long I acted like it just didn't exist, that now it feels good that I'm waking up, I'm prioritizing myself, I'm prioritizing my health. That way, I'm not going to have too many surprises. I mean, HS is, you just never know what you're going to get yourself into sometimes. But I have literally set little boundaries and steps to where, you know, it can be kind of like breezy as I can. So.
Yeah, and I think, so for people who don't know what Coban is, it's like a wrap. They use it a lot on horses, actually, so a lot of times you can get it at, like, a farm supply store in the equine area. And all it is a bandage that sticks to itself. Yeah. So it doesn't adhere to your skin, but when you wrap it around, it becomes sticky to itself. So unwrapping it does not bother, doesn't hurt anything. It's literally nothing sticking to your skin. And so it is a really good option. It does work really well for like around thighs. It can like roll up depending on where you're at. So you gotta
try to keep it
out.
in space. If I'm wrapping my thigh with a Coban, I can't just like, you can't just put some leggings, like you can put leggings on, but even when you put your leggings on, like there's a chance it's gonna roll up. So, you know, I am a full advocate for like most of the time, I'm probably not wearing regular cute Victoria's Secret underwear, right? I am a boxer girl through and through, and that's because of my thigh flares, and the Coban stays in place when I like put my my boxers on, or like we talked about in another episode, HydraWear is completely amazing wearable wound care system.
No adhesive on that one either. So yeah, definitely. I think, and HydraWear, like you mentioned, is amazing because it's along the same lines as the train of thought of the Coban of not having any adhesive on your skin. But the difference is with these, the gauze pads or their specific dressings that are created for the product actually adhere to the boxer brief or the shirt or whatever garment you're using. They have 4 different garments. They have a women's boxer brief, a men's boxer brief, a shirt, and a crop top for underarms for women. And so you would take their gauze pad that comes with it and you put it on the inside where you would need it. So if you were doing inside your thigh, you would attach it inside, and then it comes with 2 Velcro adhesive strips that go through these specifically built holes in the garment, so that you can attach that to the garment and it's not stuck to your skin. So the only thing that's against your skin is the gauze.
The gauze.
Yeah, which is really soft. And it was designed by someone with HS for us. So she recognized the trauma that can happen to your skin with tape. And so she created that product for us, which is great. So we'll link all of this in the show notes too.
And it's just super amazing. And the fact that you can, if you have wound care built into your health insurance, you can go through the proper channels to make sure that you're getting them to cover a part of that, or, you know, for your HydraWear. So I think that was so cool.
Yeah, I know. I was so happy when that happened in the US. And I think the other, if you're having trouble, so the nature of HS is non-healing wounds, right? We end up with tunnels that do not close. They are constantly seeping and draining. That is the nature of HS. So we often see people who end up with little holes after they've had a flare that has drained. And now you're left with this like little hole. Like, what am I supposed to do with this? Most of the time, I would put Aquaphor on it, and then I would cover that with gauze and tape. Now, let's talk about tape for a second. Not all tapes are created equal. I personally like Hypafix tape, but it doesn't matter what tape you're using. If you're taping over the same spot over and over and over and over, it's going to hurt. It's going to create issues on that wound bed, and create a new wound bed essentially. So it's really difficult, and pay attention to that piece of it. So what I've started to do is, if I have an abscess that I know I'm going to have to bandage for a while, I play origami. So I fold it differently so that every day I'm taping over a different spot. Sometimes I make it bigger than it has to be, so I'm taping way outside of that spot.
It's your morning jigsaw puzzle.
Right, exactly. Yeah, some people do crosswords, I play origami. Because I find that if I'm not taping over and over that same skin, that I'm saving myself a ton of pain and discomfort from that. And then I think the other piece is, there's so much in the world of wound care that just as an HS patient, we don't know anything about. Mm-hmm. So if you're having trouble with a lot of non-healing wounds, I would absolutely ask your dermatologist for a referral to wound care.
Okay.
They are amazing. They have so many different products that can help. I was actually introduced to this product, which is called Hydrofera Blue, after I had surgery, and it has been something I've used for every surgery that I've had. It's just a little piece of foam, and you would put this, like, I was using this for my pilonidal cyst too, so I would cut a piece of this out and then put it on the bandage and then adhere it between my butt cheeks, and this piece would go inside my pilonidal wound bed.
Okay.
And what it does is it brings all of that up to the surface, so that
So it's applying pressure, or
it's basically it's antibacterial and antimicrobial. I believe is what it is. I don't know because I don't know exactly, but all I know is it's like healing on steroids for me every time I use it.
Yeah.
But they have larger sheets of it too that you can cut to size. But you put it on there, and it also debrides it at the same time.
Okay.
So it sticks some of what needs to come off of the wound on here as you pull it off. Which is really nice, and it can get expensive, but you can get a big sheet of it and then cut it. So
I feel like I've seen something similar when I was a CNA watching like nurses do wound care on
yes,
the residents. Like that is, and you used to be like that is like wild that you're putting something in this wound. But it's healing versus what we were talking about on a different episode. Where so many, I'm sure people can relate, you go to the ER, or you go to an urgent care, and the next thing you know, you're getting a lance and drain, and then they're like, okay, we packed it, and then you have to take it out and, like, repack it, or take it out an inch a day, and you, like, want to die, because you're like, how the fuck can this be sanitary? Like, you're literally pulling this, it kind of looks like a straw wrapper.
Yeah, or like a piece of ribbon.
Yeah,
or something, yeah.
And it's like, this can't be fucking sanitary.
Yeah. Yeah, and packing wounds is actually not recommended for HS, which is counterintuitive to what usually happens when you have an IND. Yeah. INDs are also not recommended for HS, which is why we try to tell people to avoid ERs and urgent cares, because abscesses do not have to be drained by an incision and drainage in order to be dealt with.
Okay.
So most of them will
Can
come...
that just be like so sucked?
They
you
can
just get a syringe and just like poke it and like just suck some of that
but
stuff
there's
out, or no?
so much underneath there that you have no idea. You're like just seeing the tip of the iceberg.
You have to cut it, essentially, right?
Well, most of them will drain on their own.
Okay. Yeah.
But I think that people end up in the ER or the urgent care because they're in such pain.
Pain.
But there's a lot of different things you can do for a flare before you get to that point. Because truly, research has shown that if you have an incision and drainage, which is they just go in, they lance it, they squeeze it, everything comes out, and they pack it and send you home, there is a 100% recurrence rate. Okay, so all you're doing is buying time.
It makes sense because that's what happened when I had it severely under my armpit. They would get so bad, I would have to go in because I couldn't get through a day, and then they would lance it, and then it was reoccurring all the time.
Exactly.
All my scarring is from reoccurring, and the scar, I remember even the doctors who probably didn't know I had HS, I didn't know at the time, would be even saying, oh, it's in the exact same place as your last one. And I'd be like, yeah.
It is.
Why does it,
terrible.
And then what was happening is I kept culturing it, and it would be no MRSA,
no infection.
And I just, okay, so that's
here's a course of antibiotics.
That's good to know, and I've been blessed to not have to have anything that severe where I didn't need to go in, but I never knew that. And we've talked a lot about like kind of taking control of your own healthcare. So I'm happy I now know that they probably shouldn't do that. Which I never knew until this conversation today.
And so a lot of people do go to the ER and the urgent care for that, and it's really not advised for HS on a couple of different levels. What we're hoping that people will learn how to do, and something that we're working on educating ER and urgent care physicians on, is a procedure called a de-roofing procedure. So
I had a few questions about that.
Okay,
I was
perfect.
Today, like,
so,
is this de-roofing? What is it?
Yeah. So what an incision and drainage is they just go in, they slit it open, basically with a scalpel, they drain it, and they pack it. And then it heals over, right? And it heals a lot of times too quickly. And so all of, like, I've said this before, I don't know how else to say it, the bad juju. The bad juju doesn't have enough time to come out, or it's not ready to close yet, because a lot of times our wounds aren't closing for a specific reason, is because they're continuing to drain underneath. Because if normal body healing would say, oh, this is done, let's heal it over, but a lot of times that's not what's actually happening. And so the other piece of it...
De-roofing, what's the difference? What are they
doing?
So a
de-roofing, a lot of times what they do is with a punch biopsy tool. So it's like round at the bottom, and it's something that they use.
It's fucking scary. I'm like,
I
might take this packing shit.
It's actually more scary than a scalpel.
Okay, but go ahead. So what's happening?
It's something they would use for like pulling out for like a biopsy. So it's basically just a little round punch tool. So they would numb you up beforehand, they would punch down into your abscess, and then they cut off the little like punch, so it comes out almost like a hole punch, and they.
I'm sorry.
I'm not doing a
I'm
good job.
sorry. You're scaring the shit out of me, Sid.
Like, we don't even have to face the whole.
Like, oh, this is this is like.
No.
Oh my God,
okay,
so
so
much
it's like
better.
a hole punch. I don't know
Right.
if I like your
Yeah.
description.
I know. Okay,
But
so
okay,
it
a
looks
hole
like
punch.
a pen. Okay, so let's do this.
Seriously, because
Bring out.
I'm like, if KK could do it, I could
and
do
you were
it.
making the faces I wanted to make because I was like, what the.
Okay, so now we have the pen. So this is our punch biopsy
Okay.
tool.
Okay.
Okay. So we're gonna say that my abscess is on the back of my hand. So they take this punch biopsy tool, and let's say it goes down to like in here, middle of the pen cap
Okay.
piece. So they would go in here, they do this, they pull it up, they cut that off. So
Okay.
now you have a perfect little hole in your skin.
Okay,
It will drain.
on its own.
Yes, right then.
It should come right out.
It should
Okay.
come right out. And then what they will do is they will take a probe, which is a very thin, little, like, I'm trying to think of what I would explain it as. Like a Q-tip but longer, not a
Okay.
Q-tip, excuse me, a toothpick but longer. And they feel around
That's
in
even
there.
worse. I was like, okay, the Q-tips
It
are
keeps
round.
I'm thinking about when you get it like this with your nose and it's like, oh, this is horrible.
I'm doing a horrible job. Okay, I should have
but
just played the
but
video.
why did they put a Q-tip in?
Well, because they're probing around to see if there's any tunneling. Okay? So if there's a tunneling and they feel that opening,
Are they numbing you for this?
yes, this is numbed
Okay.
beforehand. You have no idea all of this is happening.
Okay.
Can they knock you out or no? Was it-
No, they wouldn't for this. And then, so if they feel that there's tunneling happening, then what they will do is cut that open where they feel the tunnel. Then they pull out all of the biofilm that's in there, which is what happens in tunnels, which is why tunnels do not close. The biofilm is like ripe with bacteria and nastiness.
Why don't they do that when, what's essentially the difference between if they couldn't they lance you and do the same thing though?
Well, the reason the lancing doesn't work is because it heals over too quickly.
Okay.
So
okay.
when you have a de-roofing procedure, it heals over from the inside out. When lancing, it heals outside.
Okay, okay.
So it doesn't allow the time necessary to heal from the
Okay.
inside out, which is really how HS needs to heal.
Okay, so do most doctors, if you go into the ER, know what de-roofing is?
No.
No.
So that's one of the
Okay.
things we're working on with
Okay.
education.
Because
Because
they have to learn how to do
yes,
it too.
and it's pretty much the same. I mean, it's along the same concept. If you can do an incision and drainage,
Yeah.
you can do a de-roofing.
Yeah.
It's just a matter of training,
Okay.
and then also training them for like what to look for when they're probing, what that feels like that they're looking for.
Does this take about the same time as lancing, draining?
Probably
packing?
takes a little bit longer. I
But
would
it's
say.
something you can do within
Yeah.
a visit?
Yeah.
Okay, okay.
Yeah, because with an incision and drainage, there's much less recurrence rate,
Okay.
and it's healing properly, and it's healing from
with
the
the
inside out.
with the de-roofing, there's less.
Yes.
recurrence.
Sorry, did I say that wrong?
Yeah.
Yeah.
Make sure.
Yeah, okay.
So that's the difference between the two, and
Good
it
to know.
usually takes
Both
about
suck, clearly.
yeah. Basically, it's a no-win situation, but I would choose the one with less than 100%
Yeah, no, for
recurrence
sure.
rate for sure.
And then it's just like, I feel like it just definitely depends on the area. Like some
Mhm.
of the places that I've had the incision and drainage, I'm like, okay, maybe I would have preferred the de-roofing, like on the back of my ear, you know?
Yeah.
Because now I'm like, it literally did come back.
Yeah.
It always is like a thing.
Yeah.
But maybe if you would have incision and drained, de-roofed, it would have been better.
Yeah.
But it's like, damn, how many incision and drainings have you ever had?
Me,
You know,
only
a
a
lot.
few on my butt
Really?
when I was young, 10 years old.
I have had nothing done to my butt, and
Yep.
it's the worst. Like, it's where my HS is just the worst right now.
Yeah. And these, so do you
I've
know
had at
things?
least, I'm not exaggerating, 30.
Incision
You're
drainage.
not alone.
30
Most people.
At least.
I've
And
had
all
probably
all
15.
just under my armpits.
Wow, really?
Yeah, I've never had them anywhere else, but yeah. Because mine under my armpit would, and it's been a few years luckily, but they would get so big randomly, you guys. Like, I can't express it. I would feel like I had a fever one day. I'd be like, I don't feel good. And I am telling you guys, I'd wake up with something
Yeah.
so big, and I'm not, like, unbearable. I can't move my arm. I can't get
Yeah,
through the
you're
day.
basically
So
like
then I would
saying,
try to wait a day or something, you know, and then I mean, I'd have to go in, and then I would go to the ER because I didn't have insurance or whatever. I would go in, and then they're cutting it over and draining it. Which, I mean, now I kind of get. They don't know what else to do. And I knew the doctors, they would always say, we can't really do, we can give you some painkillers. It's going to drain on its own. They would always say that too. Eventually, it's going to drain on its own.
Yeah.
On its own. But if I had to get through the day, you know what I mean?
Yeah.
So they would lance it and then packing. I mean, honestly, at least 30.
I remember going to the ER and actually like advocating against the incision and drainage just because it was like, they did tell me at the time, they're like, it's gonna pop on its own, like, and it's super angry. If anything, you can wait here for a couple hours, we'll give you some pain medication and like see what it does. By the time, you know, you're done with your fluids, we can see what your decision is gonna be if you want us to go ahead and move forward with the incision. And I remember at the time I was in a toxic relationship, and for him, like, it was the biggest fight because he's like, we came here for nothing. You know, like, oh, you're not even going to get the procedure. Like, we came here for nothing. You must not be in pain. And it was like a red flag for me because it's like, motherfucker, you are not it for me.
Well, and that would, oh God, the draining, it would be so bad. I mean, I remember vomiting numerous times. Like,
And the smell.
Yeah. Yeah.
No, but I mean, I would be on the table, boo-hoo, crying, and I could never look. I'm not gonna lie, HS everything grosses me out. So blood, so this is me, and then they'll be like, do you want me to show you? No! Like, literally, like, horrible. And then I'd be vomiting, like.
I got tough skin growing up with my mom, getting them on her breast. So my mom still doesn't like know for sure she has HS of the breast because, you know, like back then they obviously didn't know a lot. But they tried to tell her that she had fibrocystic breast disease because she would always get the abscess in her nipple. And then she was the same way. She'd be like, no, you have to like knock me out. But for one time they were like, ma'am, we can't. Like, your insurance isn't going to cover it again.
They never knock me out. I would beg them. I'd be like, can you not knock me out? They'd be like, no.
She would literally
They'd
be
be like, I'm crazy.
Yeah.
No, why are we knocking you out for that?
She's like, can you give me the Michael Jackson drug, please? Just give it to me.
And then they hear me screaming, and I know they're like, we should have knocked her ass out. But we can't.
We should have made some shit up so we could knock her out.
We should have. I know. They're all like,
yeah.
This annoying girl.
And
like,
if you want to see more about like deroofings,
Okay.
on our website, there's a healthcare provider section at hsconnect.org. And we have 3 different videos of 3 different doctors doing a deroofing procedure, so that if you're the kind of person who wants to see what it looks like before you go in, so that you can know what to expect, which I am that person. These 2 are obviously not those people.
she lost
Brinley's the type, she's like, can I watch a surgery before I go under surgery? And I'm like, no, bro, just surprise and heal me.
I always watch Caitlin's deroofings, and she's always like, as long as you're holding my hand and I can see you, then it's fine. Because I'm always like, can I see the biofilm? Can you pull that out so I can look at that?
No, my wife will be like, will you pop this pimple? I'm like, absolutely.
Oh, you tell her to
not.
come out.
I will vomit.
Oh
Like,
my
no,
God.
I can't.
I
have
am a
weak
pimple
stomach.
popper. I love
I
it.
can't. Yeah.
People are like, you should go on Dr. Pimple Popper. I'm like, I heard
So
she
my
might
biggest
be too
issue
good
with
for
my
me.
HS, y'all, is it grosses myself out. Like, I can't stomach my own, and it's horrible. It's horrible. I know.
You are not meant
I'm like,
for
don't
this
look
shit.
at
No, I am not meant for this. I can't. Like.
Oh my god. Yeah, I've had one really bad experience. Like, I can handle a lot of stuff and grossness, but after one of my surgeries, I had a huge flare on my bum. And I was in so much pain that I called and got in for a Kenalog injection. And I was on my way in the car with my mom. She was driving me. And it drained in the car.
Mm-hmm.
And it did not stop draining. And it was disgusting. And I was gagging. And my mom was just like, what is happening? And she knows I have HS. She knows how this works. But it was like the biggest flare I feel like I've ever had that's happened. And I was so incredibly grossed out. I was just like...
It's like when you reach back there and it's just wet, you're like...
Yeah. I'm like, basically, just drive me home.
Right.
Like,
we'll cancel it. We're
I'm
going
going to take my shirt off and have just my bra on, and I'm going to sit on that other shirt, you know, because it was
And it's the
horrible.
weirdest thing because it also, you know, it's good. Like, and for me, I always feel so feverish when I have one, so I can't express the second it starts draining. I feel like,
amazing.
Yeah, like literally, I cleared the plague. Like,
Right.
like literally. So okay.
And we say that same thing. I mean, you go from like a 10 out of 10 pain to a 1. And people don't understand how that happens.
But-
and you're like, do you know what just released out of my body? Like,
I'm grateful you taught me that about the packing too, because one issue I was having is they would culture when I was there, nothing, like
Yeah.
nothing bad. pack it, and then I would come back with an infection. Now, I would actually, not necessarily MRSA, but I'd have something from the packing and all that. So it was just a lose-lose, and then...
Yeah. And most of our abscesses are sterile.
Yeah.
They're not infected.
Yeah.
And then what happens is we get secondary infections from the skin. So there's good bacteria and bad bacteria on the skin. And people who overuse antibacterial soaps and stuff are actually killing off the good bacteria too. We have to have that balance on our skin of the good bacteria and the bad bacteria. So typically if you get an infection afterwards, bless you.
I'm so sorry.
It's based on the fact that you became infected from your skin being open, and then that's how the infection happens. But a lot of people are like, oh, it opened and now it's infected. It's like, yes, but this is how that happened. It wasn't because the abscess was infected. So there's so many little nuances, and like we've said before, what would look like on a person who does not have HS, if you saw that, like if I saw that on my mom, what an HS.
You're like, wow, you didn't have an infection.
You need to go to the doctor right now. And for
us,
us, this is what it looks like.
Yeah.
You know, we deal with it all the time. And so I think that's one of the points that gets missed, because there's so many things that we need to learn about HS, and the doctors only have so much time to spend with us when we're there. And
can we talk about these 15-minute appointments?
Seriously.
And how much they cost.
Yeah.
Like, oh my god.
Yeah, I mean, it's insane. And so they're not being able to give us the education that we deserve. And that's not their fault. They're not the ones who created this system, unfortunately, that doesn't allow for the time. So that's what we're here to do, is to help kind of educate people about, don't run every time. It's not an infection. Don't go to the ER. Don't go to urgent care. I understand the pain. I totally get it, but it will abate. It will go away. Try ice. So many people go heat.
Yeah.
Heat creates an inflammation cycle and keeps that inflammation cycle happening. Ice stops inflammation. So if you have a really bad abscess, ice it.
Okay.
Don't put ice directly on your skin. Please always use like a dish towel or something between it. Not something super thick, because you won't get the benefit of the ice. And with heat, moist heat is usually best. So like we have a heat versus ice article on HS Connect 2 about like what kinds of ice and heat is best. I mean, ice is ice, but different ways you can even
crushed
make
ice.
Sonic ice. The way that you can make heat packs at home that don't cost, like how you can keep them warm, those kinds of things. If your abscess is close to draining, use heat. That's going to help draw that out, and that heat will help. If it isn't close to draining, don't even think about heat. Heat may feel better, but it's actually keeping the inflammation happening. Ice will take some of that inflammation down. And sometimes that, even just that ice is enough to just, bless you.
Sorry.
My goodness, I'm the only one who hasn't sneezed. I need to sneeze now.
One last question for you, Brinley. I get a lot of questions about scarring and healing that, and can you explain a little bit about what that does or does not look like?
Yeah, scarring, there really is not much that we can do for the scarring that we have. Sometimes when we have what's called hypertrophic scarring, it's that like ropey scar tissue. And that comes with, you know, typically like stage 3 HS, where everything is kind of just becoming knotty and scarred underneath. And there really isn't much you can do for that other than having surgery to excise that area, which then you're left with different scars. But I know for me, it was a total change in my thought process about my HS when I elected to have my underarms done, because I got to choose that. Like with HS, we have so few choices and so few options about how we can do it and what we can treat ourselves with, that I was like, hey, I got to pick these scars. And so now I'm like, I own them. They're mine. I decided to get them. You know, it was a change in mindset that happened for me too as a part of that, which was amazing to see, and I never expected to have that happen. It was like, you didn't even know that was a thing.
So you're saying like surgery is one of the only options, but you'll be left with a different type of scar regardless.
Yeah, and you really, once your scarring is that bad, you know, there may be products you can use to potentially lighten them. We haven't found anything really that works across the board for everybody.
We haven't found a brand that works efficiently and also has effective marketing and like communication skills. Like, it has to be bigger than just like, oh my gosh, your product works. We want HS to be inclusive in their marketing on their social medias. Like, you shouldn't just be profiting off the whole HS community, but like, you can't post about HS. So we're just looking for the right brand that I think has the same values that aligns with ours. But I will say, as I've been like on this journey looking for that, it was just like something that I was also like, why am I prioritizing this? Like, the right person's gonna come and find us at the right time. But like, living with HS, it's also just knowing that it is chronic, and like, you can be focusing on your booty cheek scars, but like also being very understanding with the fact that like, you're trying to cover up what you think is like this scar over here because you're super insecure about it, but like, in 2 weeks you can have another scar right here. So you have to be okay with that, and I think I genuinely have overcome that this year of like, I might want to lighten a spot up, right? But I still have to be okay with the fact that, one, it may not be completely gone, and two, just learning to love myself as I am right now, and learn to love the scars. Like, I'm not saying that, it's just like, out of all things in the HS world, I feel like clear skin is like the furthest reach for us all. So, you know, like, let's learn how to manage, let's learn how to treat, let's learn how to effectively take care of our HS. And then like, cosmetically, I think we're just a little far away from making that a focal point. If you found something that works great for you, I'm so happy.
Yeah.
But I just think genuinely it's not like a huge focus for a lot of us. Well, me personally.
Yeah, and I think that in addition to that, it's important to understand that we can get scarring even without having an abscess rupture. So my daughter has different HS than I do. Hers doesn't typically drain. Hers comes up, gets angry, and then subsides. She still is left with scarring.
Yeah, no.
That's the damage that the inflammation is doing underneath our skin. So even though she had nothing come out of that flare left a mark. And to me, I'm just like, I didn't realize that before because that's not the way my HS acts. So in watching that in her, I was like, what? Like, that's a lot of damage underneath the skin to show up that way.
Is healing and scarring like a synonym?
That's a really good question, and I don't know the answer.
Yeah.
I mean, I feel like with HS, when you heal, you are left with a scar.
Yeah.
So healing is like that process of the skin closing, and then scarring is the result of that.
Okay.
Is kind of how I think of it in my head. Whether I'm right or wrong, I have no idea, but that's my thought process.
Gotcha.
Yeah.
Okay.
Any other burning questions?
No.
Yeah. Wound care is a personal thing, just like everything else with HS. If you're going through a lot of gauze, I order all of my stuff on Amazon. I love that it delivers to my house, first of all, it's heaven. And you can get like 4x4 gauze. There's a difference between woven and non-woven, so look at the pictures. Hydrofera Blue, we'll link all of it in the show notes too. There is another kind of silicone bordered gauze that I highly recommend, especially if you have flares in areas where you need a little more cushion. We call them in our house cloud bandages. They're made by Alleven, I think is who it is, so we'll link them in there. They are a little bit expensive, but if you're like walking all day and you have a flare between your legs, like these are the bandages you're going to want to go for because it's almost like a little memory foam. Yeah, so we
love a memory foam.
I know. So think about that between you.
Yeah.
So we came across these.
Sounds like a good idea.
Yeah.
Yes or not. Okay.
My kids absolutely love these. Cannot speak highly enough of them. So they would be worth a try. Like I said, they are a bit on the expensive side, but I feel like hopefully in the future, wound care will be something that is covered under medical insurance for HS, like our wound care supplies, because this is a huge burden of cost on us. It really is. And I think we don't think about it because it's just normal for us to have to go in and order things. But I think that for the normal person, I mean, before I had surgery, just to order my supplies to have afterwards, it was $150 on Amazon, just to make sure I had the supplies I needed for wound care changes when I came home. So,
but no, even when I run into Target to just get basics, I mean, I'm looking at $30 just for basics re-up, you know.
Yeah.
It adds up, so hopefully soon.
Yeah, so that is something that's on the radar as far as that goes for sure.
Yeah.
Trying to make sure that we have some some coverage.
Affordable stuff.
Yeah.
It is so expensive. Well, if you follow me, I will be sure to link everything that was talked about in my Amazon storefront. That way it's easy to find. Brinley needs to get hers together because she's an Amazon queen. I went to her house, I was like, is it Christmas in July? Because it's a lot of Amazon packages, girl. But we will make sure that everything is linked for you guys, and just make sure that you're taking care of your HS, and start small, and then eventually you'll have yourself a nice little collection, and you'll feel good about that. If you want to start, if you don't know where to start, you can absolutely start with the Flare Care Kit. You can go to hsconnect.org or go to the link in the bio. Just donate, and if you're international, it'll be $55. If you're US, it's going to be $30. Both of those prices include shipping, and you'll be able to kind of just try a few different options and see what you like, and then you can go back and buy in bulk as you need. So thank you guys so much for tuning into this episode of Hydradenitis Super Divas on wound care.
We're the Hydradenitis Super Divas. If you've got HS, you'll want to meet us. It's not your fault, put the shame to a halt. HS divas know how to have a ball. The Hydradenitis Super Divas. Put the shame to a halt, cause it's not your fault.